1. What is the primary goal of geriatric nursing care? A. Preventing infections. B. Promoting independence. C. Controlling pain. D. Providing medication. 2. A GNA should reposition a bedbound resident at least. A. Every hour. B. Every 4 hours. C. Every 2 hours. D. Every 6 hours. 3. Which of the following best describes the proper use of a mechanical lift? A. Used only for lifting residents weighing over 250 pounds. B. Requires at least 2 trained staff. C. Can be used by family members. D. Only for emergency evacuation. 4. When providing oral care for an unconscious resident, the GNA must A. Use toothpaste with alcohol. B. Avoid touching the gums. C. Turn the resident to the side. D. Place the resident in high Fowler's position. 5. Which is the first step when using a gait belt to assist a resident? A. Place the belt around the chest. B. Ensure the belt is loose. C. Explain the procedure. D. Lift the resident quickly. 6. Which condition requires contact precautions? A. Tuberculosis. B. Influenza. C. MRSA in a wound. D. Hepatitis A. 7. When a resident complains of pain, the GNA should A. Ignore it unless the resident is crying. B. Tell the nurse. C. Give Tylenol. D. Distract the resident. 8. Which of the following is considered a restraint? A. Bed alarm. B. Bed rails used to prevent falls. C. Locked wheelchair. D. Reclining chair. 9. Before feeding a resident with dysphagia, the GNA should A. Offer large portions. B. Check for swallowing reflex. C. Lower the head of the bed. D. Use a regular diet. 10. A resident with dementia is wandering. What is the GNA's best action? A. Lock the resident in their room. B. Physically restrain them. C. Redirect their attention. D. Yell to stop them. 11. The most effective method of preventing infection is A. Wearing gloves. B. Sterilizing equipment. C. Hand washing. D. Using isolation. 12. PPE includes all of the following except A. Gloves. B. Gown. C. Mask. D. Hairnet. 13. When cleaning a spill that may contain blood, use A. Bleach solution. B. Vinegar. C. Soap and water. D. Alcohol wipes. 14. Which statement is true about standard precautions? A. Only used for residents with known infections. B. Includes wearing gloves for all resident care. C. Used for all residents. D. Only used during isolation. 15. Sharps should be disposed of A. In a regular trash can. B. In a biohazard bag. C. In a locked drawer. D. In a designated sharps container. 16. Dentures should be cleaned using A. Hot water and toothpaste. B. Cool water and soap. C. Bleach solution. D. Vinegar and water. 17. When giving a bed bath, always A. Use cold water. B. Wash the face last. C. Cover the resident for privacy. D. Use scented soap. 18. The perineal area should be cleaned. A. Back to front. B. Circular motion. C. Side to side. D. Front to back. 19. Foot care for a diabetic resident should A. Be done aggressively to prevent calluses. B. Include trimming nails deeply. C. Be reported to the nurse if abnormalities found. D. Be skipped if the resident is ticklish. 20. When dressing a resident with a weak arm, dress A. Strong side first. B. Weak side first. C. In any order. D. Both arms at the same time. 21. A resident begins crying after a visit. The GNA should A. Leave them alone. B. Tell them to stop. C. Offer a listening ear. D. Report them to the nurse immediately. 22. Sundowning refers to A. Increased confusion in the morning. B. Clarity during the night. C. Confusion during the evening. D. Energy boosts after lunch. 23. Validation therapy is useful for A. Correcting delusions. B. Arguing with the resident. C. Supporting the resident's reality. D. Reorienting to the current date. 24. Depression in the elderly is A. Rare and not serious. B. A normal part of aging. C. Often overlooked. D. Treated with physical therapy. 25. A resident refuses care. The GNA should A. Force care. B. Document refusal and report. C. Ignore the resident. D. Wait until next shift. 26. A resident frequently calls out for her deceased husband. The GNA should A. Tell her he is dead. B. Pretend to call him. C. Calmly redirect the conversation. D. Leave her alone. 27. Residents have the right to A. Refuse medication. B. Have no visitors. C. Share a room with anyone. D. Change facility policy. 28. Which behavior is common in residents with Alzheimer's disease? A. Quick learning. B. Wandering. C. Logical decisions. D. Improved memory. 29. A resident is talking to someone who isn't there. The GNA should A. Laugh with them. B. Correct them immediately. C. Notify the nurse. D. Shout to distract them. 30. Social isolation can lead to A. Increased appetite. B. Higher blood pressure. C. Better sleep. D. Depression and anxiety. 31. The GNA must report suspected abuse to A. The resident's roommate. B. Another CNA. C. The licensed nurse or supervisor. D. The resident's family. 32. Residents have the legal right to A. Withhold information from staff. B. Smoke wherever they want. C. Be free from restraints. D. Demand a private room. 33. Which of the following is a sign of possible neglect? A. Clean clothes. B. Dry skin. C. Pressure injuries. D. Trimmed nails. 34. Confidentiality is maintained by A. Avoiding eye contact. B. Discussing resident info only with authorized staff. C. Sharing notes with family. D. Posting updates in public areas. 35. Informed consent means A. The nurse gives permission. B. The doctor orders it. C. The resident understands and agrees to the care. D. The GNA makes the decision. 36. If a resident is hard of hearing, the GNA should A. Shout into their ear. B. Speak slowly and clearly. C. Use baby talk. D. Avoid conversation. 37. Nonverbal communication includes A. Emails. B. Talking. C. Gestures. D. Phone calls. 38. Which of the following is an appropriate way to address a resident? A. Honey. B. Sweetie. C. Mr. Johnson. D. Grandpa. 39. When communicating with a confused resident, it is best to A. Use long, detailed instructions. B. Speak quickly to finish sooner. C. Use simple and short sentences. D. Avoid eye contact. 40. If a resident speaks a different language, the GNA should A. Use a family member to translate. B. Avoid caring for that resident. C. Use gestures or request an interpreter. D. Guess what they want. 41. Thickened liquids are ordered for residents with A. Dementia. B. Dysphagia. C. Diabetes. D. Hypertension. 42. Before feeding a resident, the GNA should A. Wash the resident's hands. B. Offer coffee. C. Lower the bed. D. Ask the nurse to help. 43. Signs of dehydration include A. Moist lips. B. Increased urination. C. Confusion and dry mouth. D. Warm skin. 44. The best way to ensure a resident eats enough is to A. Stand over them. B. Sit and encourage them patiently. C. Force feed them. D. Call their family. 45. A diabetic resident is given regular soda. What should the GNA do? A. Let them drink it. B. Offer another resident. C. Replace with diet soda if allowed. D. Report it to the nurse. 46. A care plan includes ROM exercises. The GNA should A. Skip them if the resident refuses. B. Perform as directed and report problems. C. Perform as many as possible quickly. D. Only perform when the resident is asleep. 47. When ambulating a resident with a weak side, the GNA should A. Walk on their strong side. B. Walk behind them. C. Walk on the weak side and support. D. Let them walk alone. 48. A resident refuses physical therapy. The GNA should A. Ignore the care plan. B. Report the refusal. C. Threaten to report them. D. Do the therapy alone. 49. Which of the following helps maintain joint mobility? A. Bed rest. B. Isolation. C. Range of motion. D. Massage only. 50. When using a walker, a resident should A. Place it behind them. B. Slide it with every step. C. Move the walker forward, then step. D. Hold with one hand. 51. If a resident is choking and cannot speak, the GNA should A. Give water. B. Perform Heimlich maneuver. C. Call the nurse and wait. D. Lay them down. 52. If a resident falls and is conscious, the GNA should A. Help them up immediately. B. Move them to a chair. C. Stay with them and call the nurse. D. Leave to get help. 53. In case of a fire, RACE stands for A. Run, act, call, evacuate. B. Rescue, alarm, confine, extinguish. C. React, alert, calm, evacuate. D. Report, avoid, contain, exit. 54. A GNA finds a resident on the floor. First action: A. Help them back to bed. B. Check for breathing and call for help. C. Leave to call family. D. Scold the resident. 55. Seizure care includes A. Holding the resident down. B. Putting a spoon in their mouth. C. Turning them to the side and protecting the head. D. Giving them water. 56. Hospice care focuses on A. Curing illness. B. Rehabilitation. C. Comfort and dignity. D. Isolation. 57. When a resident dies, the GNA should A. Call 911. B. Notify the nurse immediately. C. Clean the room. D. Move the body. 58. Signs of impending death include A. Increased appetite. B. Cold extremities and slow breathing. C. Hyperactivity. D. Warm skin. 59. Which is an appropriate GNA response to grief? A. You'll get over it. B. Don't cry. C. I'm here if you want to talk. D. This is normal. 60. Postmortem care includes A. Notifying the family. B. Removing 4 lines. C. Cleaning the body respectfully. D. Starting CPR. 61. A resident refuses care due to cultural beliefs. The GNA should A. Insist on care. B. Respect and report to the nurse. C. Ignore their beliefs. D. Offer punishment. 62. Dietary preferences based on religion should be A. Ignored. B. Provided if convenient. C. Respected and accommodated. D. Rejected. 63. Which is true about cultural sensitivity? A. Treating everyone the same. B. Forcing beliefs. C. Asking respectful questions. D. Ignoring differences. 64. If a resident prays at certain times, the GNA should A. Interrupt. B. Encourage and schedule care accordingly. C. Remove religious materials. D. Make jokes. 65. Language barriers should be addressed by A. Avoiding the resident. B. Using interpreter services. C. Writing in English. D. Ignoring care instructions. 66. CNAs can A. Change sterile dressings. B. Administer 4 fluids. C. Report vital signs and changes. D. Prescribe medication. 67. The care plan is A. Optional. B. For the doctor only. C. A legal guide to resident care. D. Irrelevant. 68. Reporting observations is part of A. The physician's role. B. The family's role. C. The GNA's responsibility. D. The nurse's aid only. 69. Documentation must be A. Done weekly. B. In pencil. C. Accurate and timely. D. Verbally told to a coworker. 70. If assigned a task outside the GNA's scope, the proper action is A. Attempt it carefully. B. Refuse and notify the nurse. C. Do it once. D. Ask another GNA. 71. Signs of a urinary tract infection in the elderly include A. Clear urine and no pain. B. Confusion and foul-smelling urine. C. Lower blood pressure. D. Improved appetite. 72. A resident with congestive heart failure should be monitored for A. Weight loss. B. Swelling in legs and difficulty breathing. C. Rapid hair growth. D. Tingling fingers. 73. Osteoporosis increases the risk of A. Muscle cramps. B. Skin rash. C. Bone fractures. D. Headaches. 74. A stroke can lead to A. Improved memory. B. Paralysis on one side. C. Better coordination. D. Weight gain. 75. Residents with COPD may need A. Low sodium diet. B. Oxygen therapy. C. Daily insulin. D. Bed rest only. 76. Diabetes management includes A. Avoiding sugar only. B. Monitoring blood sugar and foot care. C. Skipping meals. D. Drinking lots of soda. 77. Arthritis in older adults may cause A. Skin ulcers. B. Difficulty with movement. C. Improved flexibility. D. Lung congestion. 78. Constipation in elderly residents is often due to A. Too much water. B. High activity level. C. Low fiber diet and immobility. D. Viral infection. 79. Pressure ulcers commonly occur A. On the face. B. On the heels and sacrum. C. On the palms. D. On the stomach. 80. Parkinson's disease primarily affects A. Vision. B. Digestion. C. Muscle control and movement. D. Skin health. 81. When using a bedpan, the resident should be in A. Supine position. B. Lying flat. C. High Fowler's position. D. Side lying. 82. Oxygen tubing should be checked for A. Moisture, B. Kinks or disconnection, C. Blood, D. Nail polish. 83. A resident with a catheter should have the drainage bag A. Placed on the floor, B. Attached to the bed frame below the bladder, C. Emptied once per week, D. Attached to four-pole. 84. A sit-to-stand lift is used when the resident A. Can bear some weight, B. Is unconscious, C. Needs full body support, D. Is immobile. 85. A pulse oximeter measures A. Temperature, B. Oxygen saturation, C. Blood sugar, D. Blood pressure. 86. Which change should be reported immediately? A. Mild headache, B. Decreased appetite, C. Sudden slurred speech, D. Mild confusion. 87. A GNA observes a bruise on a resident's arm. The GNA should A. Ignore it, B. Tell another CNA, C. Report it to the nurse, D. Call the family. 88. Objective observations include A. The resident seems sad, B. The resident's blood pressure is 140/90, C. The resident doesn't like food, D. The resident looks tired. 89. A resident complains of chest pain. The GNA should A. Give aspirin, B. Help them lie down and notify the nurse immediately, C. Encourage walking, D. Ignore if it has happened before. 90. If a resident becomes confused suddenly, the GNA should A. Give candy, B. Keep them alone, C. Stay calm and notify the nurse, D. Call 911. 91. A cluttered room increases the risk of A. Comfort, B. Restful sleep, C. Falls, D. Appetite. 92. The best way to promote independence is to A. Do everything for the resident, B. Encourage them to do as much as possible, C. Avoid involving them, D. Ignore their preferences. 93. Clean linens should be placed A. On the floor, B. On the over-bed table, C. On a clean surface, D. On the bedside toilet. 94. A GNA spills food on a resident's shirt. The appropriate action is to A. Ignore it, B. Blame the resident, C. Apologize and help clean, D. Leave it for the next shift. 95. Bath water should be checked A. By the nurse, B. With a thermometer only, C. By asking the resident, D. Using the GNA's inner wrist. Geriatric Nursing Assistant. The Geriatric Nursing Assistant GNA exam is a certification test designed to evaluate the knowledge and practical skills of individuals seeking to provide care for elderly patients in long-term care settings, such as nursing homes and assisted living facilities. This exam is typically required in states like Maryland following successful completion of a state-approved Certified Nursing Assistant CNA program with a geriatric focus. The GNA exam assesses key competencies in areas such as infection control, communication, safety, personal care skills, patient rights, and assisting residents with activities of daily living. Passing the GNA exam qualifies candidates to be listed on the state registry and work legally as GNAs, ensuring they can provide compassionate, safe, and effective care tailored to the needs of aging populations. Here are the top 5 beneficial uses of the sample exam. 1. Credentialing and employment. The GNA exam provides official certification, making candidates eligible for employment in nursing homes and long-term care facilities. 2. Demonstrates competency. It verifies that individuals possess the required knowledge and skills to safely and effectively care for elderly patients, especially those with chronic or age-related conditions. 3. Improves quality of care. Certified GNAs contribute to better health outcomes and overall quality of life for seniors by applying best practices in hygiene, mobility, communication, and daily care. 4. Career advancement. GNA certification can open doors to further education and higher-level roles, such as licensed practical nurse LPN or registered nurse RN. 5. Legal and ethical compliance. Being certified helps ensure care is delivered in accordance with state regulations and ethical standards, reducing the risk of malpractice.